Herpes viruses. Herpes viruses is a viral group. Consists double-stranded DNA. So linear DNA double-stranded virus. Shape spherical isocohedron. Size around 150 to 200 nanometers. There are more than 35 proteins around the spikes and its envelope virus. Replication from nucleus is a body. In herpes viruses, we group broadly into three groups: alpha, beta, and gamma. Alpha, that is HSV herpes simplex virus 1, 2, and varicella zoster virus. Usually, they are short replicative cycle, 12 to 18 hours. They reside in sensory ganglia. But beta herpes viruses, they are in CMV, cytomegalovirus, human herpes virus 6 and 7. Their replicative cycle is more than 24 hours. They reside usually in salivary glands and other body organs. For gamma herpes virus, Epstein-Barr virus and human herpes virus 8, they are in a narrow range. Lymphoblast cells, in the lymphoblastoid cells, there is species 1, 2, varicella alpha-like, then beta and gamma. Caposarcoma, which produce HHV8, human herpes virus 8. About herpes simplex, HSV1 and 2. Clinical manifestation, again broad spectrum. Variety of clinical manifestations: acute gingivostomatitis, herpes labialis, its term also ocular herpes in eye, herpes genitalis in genitals, other form of cutaneous herpes there, and meningitis. Most important thing is encephalitis and neonatal herpes. Gingivostomatitis surround the oral mucosa. Commonest manifestation of primary herpetic infection. It's the commonest. Patient experiences pain and bleeding of the gums, gingivostomatitis, corners of the mouth and gum. 1 to 8 millimeter ulcers with necrotic bases are present usually. Neck glands are commonly enlarged, leads to draining lymph nodes, accompanied by fever. It's a self-limiting condition, lasts about 10 to 13 days. You can see herpes simplex primary acute herpetic gingivostomatitis. Herpes labialis. It's a recurrence of, it's also recurrence of oral HSV. 45% of orally infected individuals will experience reactivation. The actual frequency of recurrences varies widely between individuals. Tingling, warmth, or itching at the site usually tell the recurrence. About 12 hours later, redness appears, followed by papules and then develop into vesicles. Symptoms show on the inside of the cheek or gum: fever, general discomfort, malaise, ill feeling, very sore mouth with no desire to eat. Halitosis, bad breath, not able to chew or swallow. So you can see cause, it's painful condition. Ocular herpes leads to keratitis, HSC keratitis, dendritic ulcers, recurrent HSC keratitis, conjunctivitis, acute necrotinitis also there, chorioretinitis, and endophthalmitis also can develop. Keratoconjunctivitis, so it's the eye lesion. Once we do in the eye lesions, we can appreciate that. Present as swelling of the conjunctiva and eyelids. You can see swelling of the conjunctiva, right? Like encephalitis is the terrible condition. Herpes simplex HSV encephalitis is one of the most serious complications of herpes simplex disease. Two forms, neonatal and adult form of focal disease. Neonatal, there is a global involvement of brain. Almost brain is liquefied. Mortality rate is 100% if child develops neonatal HSV herpes. Focal, it affects the focal or part of the brain. Most commonly affected site is temporal. This form the disease appears in the children and adults. So it is broad age category. It is possible that many of these cases arise from reactivation of the virus. Virus reside in lymphoid tissues and ganglia, sorry, it's neuronal ganglia, and they later goes into activation. Mortality rate is high, around 70% without treatment. It's the most important to make diagnosis HSV early, herpes simplex encephalitis. General cases in patient present with encephalitis: headache, loss of consciousness, fever. In meningitis, headache, fever is there, and meningitic pain. But in here, if it is patient presenting with those features plus, if having loss of consciousness or alteration of consciousness, until proven otherwise, it is encephalitis. And most of major common manifestation, more common etiology is HSV. So always empiric intravenous acyclovir antiviral is prescribed until reports available. You can see in the computer tomography, CT scan, and in otoscopy. Patient has passed away in otoscopy, so liquefied. Meningitis is more or less less common, and HSV2 and HSV2 type, which use the commoner. HSV1 usually upper body, HSV2 in lower body. HSV1 usually encephalitis, but HSV2 gives herpes, simplex, genital ulcers, genitalis like infections. But HSV2 can cause meningitis as well as oral lesions following in oral sex, but HSV1 is the one which common to cause encephalitis. Usually meningitis, viral meningitis compared to bacterial meningitis is benign, self-limiting. So usually affects sexually active young adults. Usually proceed with no neurological sequelae. No clear if acyclovir treatment alter cause of mild meningitis. So there is no proven reports. Genital herpes. What I said earlier, it is mainly HSV2. Lesion of genital herpes are particularly prone to secondary bacterial infection like Staphylococcus, Trichomonas and Candida, and Streptococcus. Candida is a fungus. At the same time, those who are having genital herpes, it's regarded as a venereological disease or sexually transmitted infection. They are more prone to develop other sexual transmitting infections like HIV because mucosal integrity is disrupted. They cause ulcers. So, breakage of epithelial barrier ultimately made vulnerable to develop or acquire other infections, sexually transmitting infections. So, always patient comes with comes and diagnosed with genital herpes. It's advised to screen other sexually transmitting infections. So they may produce with ulcers and also dysuria. 60% patients with genital herpes will experience recurrences. Recurrent lesions in the perianal area tend to more numerous and persist longer than their oral HSV counterpart. Congenital perinatal. Perinatal infections, 75% are due to HSV2. They acquire during delivery because it's in more prone to develop HSV2. I said it's in the genital area. Postnatal infection, it's mainly acquired HSV1 from maternal genital oral breast lesions, so nosocomial infection from other infected babies. It is, mind you, it's not common in our setup. So you can see lesions there. Herpetic whitlow is a lesion on a finger or thumb. You can see here. It's my herpes simplex, HSV1 or 2. How do we diagnose? Clinical diagnosis would be helpful, but we do nowadays polymerase chain reaction directly, or go for immunofluorescence or rarely immune electron microscope. So we can see in the cell culture cytopathic effect of HSV in cell culture, but it's not performed. Infected epithelial cells from direct fluorescent antibody test, so it's done, and PCR is most foremost. Viral isolation is termed as gold standard, but it's not done. Prepared test if genital ulcers or other mucocutaneous lesions are present. Highly specific. Sensory depends on the stage of lesion. And when lesion goes healing, sensitivity drastically reduced. Positive more often in primary infection than with recurrences in isolation. PCR is the foremost best. Nowadays, it's done for spinal fluid to exclude encephalitis as well. Nowadays, it's available. Type-specific serology tests are there, but it takes several weeks to few months to develop. So its diagnostic role is less valid. Herpes B virus is another one, alpha, known as permissimi, officially known as cercospicine herpes virus 1, almost always fatal in humans, but it's a rare. It causes CNS, infection, central nervous system, cause substantial damage. Leads to serious neurological disorders. No effective treatment is available. Management. There is no method to eradicate herpes virus from the body, but antiviral medication can reduce the frequency, duration, and severity of outbreaks. Apart from that, supportive care like analgesics such as ibuprofen and acetaminophen, that is paracetamol, can reduce the pain and fever. Topical anesthetic treatments such as pilocaine, bupivacaine, benzocaine, tetracaine can also relieve itching and pain. Antivirus, here we mainly use this acyclovir. Also, valcyclovir, famiciclovir, and penciclovir are also used. In Sri Lanka, acyclovir is most often used drug. About varicella, it's chickenpox. Primary infection result in varicella or chickenpox. Incubation period usually 2 to 3 weeks. Cause first is present with fever, lymphadenopathy, and widespread vesicular rash. The features are so characteristic that diagnosis can usually be made of clinical. It's clinical diagnosis. Different stage of healing, vesicles, crusting. But if fluid is there, it's infectious. Complications usually rare, more frequent and with greater severity in adults compared to children. Another thing is in compared to immunocompetent patients, immunocompromised patients have a severe form of disease. Most common complication is secondary bacterial infection of the vesicles. So those who are in vesicles, always we advise clostridial use for clindamycin. Severe complication leads to life-threatening infections such as pneumonia, viral pneumonia, pneumonitis, encephalitis, and hemorrhagic chickenpox. They are ultimately fatal. You can see multiple areas. Neonatal varicella, it's required to diagnose because child is at risk compared to mother. Can cross the placenta. Virus can cross the placenta in late stage of the pregnancy to infect the fetal congenital. So if fetus is infected while in the fetus embryo, so while in the uterus, so child like a congenital varicella. That's a terrible condition, which leads to teratogenic effect is there. At the same time, limb hypoplasia is there. It may be mild, but fatal dissemination also there. Ultimately, to stillbirths. If rash in mother occurs more than 1 week before delivery, then sufficient immunity would have been transferred to fetus. Sourced immunoglobulin should be given to susceptible pregnant women who had contact with suspected cases of varicella. Same time, sourced immunoglobulin should be given to infants whose mother developed varicella during last 7 days of pregnancy or the first 14 days after delivery. That's the window. Within 7 days before delivery and after 14 days on delivery. So they are on that particular period, virus would go transplacentally, reach the fetus, no time to develop, even no time to develop